It is the voice of Indiana County, WCCS 101.1 FM and AM 1160. And we're happy to be joined in the studio by Dr. Dan Clark. Our conversation brought to you by Marcus and Mack, a law firm representing injured people. It's good to have you with us here today and on Facebook too. Good morning.
Good morning. It's been a while.
Yeah, it really has. This has been 2020 is the year that we're going to put through the shredder as quickly as we can.
Right.
But we've still got a half a year to go, and we've got some things to talk about with you this morning. First of all, I know there's COVID-19 to talk about. We'll get to that, but congratulations to the entire surgical team at IRMC and the hospital as a whole. 1,000 cases robotically?
Correct. Yep.
Wow.
It got delayed a little bit when we shut down for COVID, but in May 10th, we reached our 1,000th case for robotics at IRMC, and that's actually pretty remarkable in less than 2.5 years to get to 1,000 cases, even with 2 months of no surgery thrown in between there.
Yeah, it absolutely is. So let's go back and review. When this program began, you were brought in right at the very start to help IRMC get it going, and since that time, you've been leading the robotics department. You've got some really good people working there too, don't you?
Yeah, and I have to give the credit to Andy Billen, Dr. Billen. You know, he had the insight to bring robotics to Indiana. And he was really the motivating factor behind getting robotics here. He did the first case and he did the 1,000th case.
Oh, yeah.
And so it just worked out that way, you know. And Andy, you know, realized that in order to bring the robotics program to fruition, they needed a more of a experienced expert in it, and he sought me out, and they had me come up here and teach, you know, proctor the system. And I've told the story to you before. When I came in, all of a sudden Steve Wolf shows up at lunch with Andy, and you know, that's not the usual that the CEO shows up and asks me how I like the hospital. It's such a beautiful hospital. It's such a gem here. You know, the facilities are state of the art, and nobody has what this hospital has. And I've been all over the country proctoring robotics and even into Canada. And you know, what they have here from the facilities in the operating room are outstanding. And so it enticed me, and so I decided to come up and take charge of the program.
I'm sure that shocked a lot of people to hear what you just said about IRMC being so far ahead of the game.
Right. You wouldn't think it, you know, and I didn't think it, you know, and I've been to many community hospitals to proctor robotics. I had never been to Indiana before, you know, and I lived, you know, 45 minutes away, and I had never been to Indiana. And the town is such a nice town, you know, with the college atmosphere and, you know, all the restaurants and everything, you know, when all this stuff lifts and we can get back to normal, it's a beautiful town. And so I toured the town and the hospital and was really impressed. And, you know, and I think it's a draw for other surgeons to come here as well.
You know, there are two things that come to my mind. Commitment, number one, by IRMC to this program, and two, professionalism in the staff.
Right. Yeah, you know, the program and the staff, to get to 1,000 cases, it's not just a surgeon. You know, it takes an outstanding staff, and we have that in the operating room, and the nursing staff on the floor are fantastic, because we have different protocols for robotics. It's not like your father's open surgery where you spend a week to 2 weeks in the hospital. We get people up right away. They can eat almost immediately after surgery, and that's a whole new mindset. And the staff embraced it. I can't speak highly enough about the administration. You know, Steve Wolf and the other administrators have been absolutely supportive with us, you know, and it has really progressed the whole institution as a result.
Talking with Dr. Dan Clark, 1,000 robotic surgery cases now having been performed at the Indiana Regional Medical Center. I've talked to patients who've been through the process. Number one thing they say is, I had no idea what it was. I had a completely errant picture of what robotic surgery is. And then the second thing that comes to mind is, well, what is it? How is it done in such a way that it has become such a groundbreaker?
Yeah, it's minimally invasive surgery, which we've been doing laparoscopic, you know, which lapro, I always explain to patients, means abdomen, and scopic is putting a scope in the abdomen. So robotics is laparoscopic surgery. We put a robotic scope into the abdomen. But with laparoscopic surgery, you have straight instruments, and they spin one-dimensional and open and close, and that's it, because they're straight. There's no wristed on them or anything. With robotics, you have all that, but because of the interface with the computer and their wristed instruments, so now we have 3 little wrists in there. So this is laparoscopic, but we now have wristed instruments. So you have 360-degree motion with your instrumentation, just like your wrist. It mimics the human wrist. So you can get in there and you can suture, you can reach around things, you can dissect up and down and backwards, just like your hand. So that's the huge benefit of robotics. But the other benefit is visualization. With laparoscopic, you have up to 10 times magnification, or 4 times, I'm sorry, with laparoscopic. With robotics, you have up to 10 times magnification. So vessels that are small, and you use small sutures and small needles, you get in there and the needle looks big, the vessel looks big. We can suture things together robotically that we never could laparoscopically. So it advances our abilities to do more advanced surgery, such as colorectal surgery, and I do all the complex diaphragm work with the big hiatal hernias, and where people's entire stomachs are in their chests, and that's the other thing that robotics has brought to Indiana County that was not available before. By recruiting me, I also do the advanced procedures here now as well. The complex abdominal wall reconstructions, to do those open, you would basically have to fillet the skin back to rearrange all the muscles. It's when people have had multiple hernia repairs and there's not much else left, we have to rearrange the musculature of the abdomen to get it closed again. Well, to do that open is extremely what we call morbid. It has a high complication rate with infections and fluid buildup. I can now go in and robotically dissect in between the muscle layers. I can get that little camera in there and separate the muscles internally through little holes. There's no big incision and everything, and people used to stay up to 2 weeks with a lot of pain after that operation. They're going home in 2 days with no pain medication now after the robotics procedure.
I was just thinking about term of stay and recoverability, how quickly that is happening now with robotic surgery. And of course, the accuracy that you mentioned, even, the old style, before even laparoscopic procedures came along, you couldn't do anything nearly as precise as this.
Right. I mean, example is the colorectal cases that we do. We go in and take out a section of the colon for either colon cancer or diverticulitis. It used to be 7 to 10 days standard in the hospital. Now my average length of stay is 2 days in the hospital. So out of the hospital in 2 days, and the vast majority of patients are going home without narcotic pain medication. For taking the section of your colon out.
Wow, that's just tremendous. Okay, so folks watching on Facebook will note that you have a comprehensive breast cancer center shirt on today.
Right.
That's another hat that you wear at the Indiana Regional Medical Center. We're thinking now about 2020 being the year of the pandemic, the various changes that have been announced, the various ways that the hospital is dealing with things. Let's first of all talk about I want to get to the comprehensive breast cancer because that's going to be a part of this conversation too. But overall operations at the Indiana Regional Medical Center now during the pandemic, as the information comes and changes every single day, IRMC's been on top of it.
Yeah, we have a daily task force call that I'm included in, and there are a lot of other physicians and administrators and such that we all get together every day. I can't always make it because I'm operating, but we review this latest state of what's going on daily, and we change, and I try to explain this to other people. It has to be fluid because this information is changing almost daily as far as cases and our education about the virus itself and how long it stays around in the air and things like that. So we modify things as we go, but we are doing everything we possibly can to make the hospital the safest place to be. And I can tell you it's far safer than going out in the community to, I don't want to say a specific name, but different department stores and grocery stores. The hospital is far safer because everybody who comes in is screened. Everybody has to wear a mask in the hospital and in my office, in the doctor's offices. Every pre-op patient is screened for COVID-19 because what we don't want to do is bring COVID-19 into the operative theater, you know. And so now naturally there are times when we have to operate on somebody who has COVID-19. Fortunately in Indiana County that is pretty rare because we have such a low volume of positive cases here. But we are ready for that. We have had to do a few cases, and they're in a separate operating room. When they have the breathing tube put in, they're in a room that's called negative pressure, which actually forces air in rather than out, so it contains the virus. while they're getting the breathing tube put in for surgery. And everybody nobody else but anesthesia is in there with them. Everybody wears proper protective equipment. And that's for the people who have the actual COVID or are at high risk and we don't have time, emergency or urgent cases and we don't have time to get their test back. We take full precautions and limit exposure that way. But even for elective surgeries, you come in, you get screened for COVID-19 because we don't want that asymptomatic patient who doesn't know that they have COVID-19 bringing it in, and then we're exposing it to our immunocompromised hospital population or exposing our staff to it. And so we are pre-screening 100% of surgical patients for surgery as well.
And of course, you've got Sonny the robot, who is very, very hard at work, making sure everything is as clean as Sonny can make it. Got an army of people at IRMC cleaning constantly and just making sure that whatever can be covered by this is covered by it. You've been really working hard at IRMC to make sure everybody's safe, and it's worked.
It has, and and the other thing we have these little UV boxes all over the place, and so we are putting our N95 masks and sterilizing them with the UV lights, and everything. I've made sure that anesthesia and the OR personnel all have proper protective equipment. The surgeons, if we need N95s, we all have 5 N95 masks, so we're not using the same mask over and over again. IRMC has gone out of their way to try to make sure that their staff has proper PPE. I hear all these horror stories about, hospitals not supplying it. And they have been very facilitative with getting us the proper PPE that we need as well.
I should point out that you and I are physically distanced here this morning, so that we're doing our best to stay safe as well. All right, breast cancer, Comprehensive Breast Center. What it does to me seeing you in that shirt, it points out to me that IRMC continues to offer full range of services. Women should not put off breast care. Nobody should put off any medical care because IRMC is here for them.
Absolutely. The one thing that we saw with this COVID-19 was people were afraid to go to the doctor. And our office visits dropped off dramatically. I was seeing 1/3 of the patients, and that was by telemedicine. And part of the Comprehensive Breast Center, as you know, is I brought genetic testing to the area and genetic counseling. And my genetic practice dropped off dramatically as a result. Now, my genetic practice is booked out that I'm, I kind of limited to the number of people per day I can see because we get telemedicine with genetic counselors, and then I go over the results with them or the potential outcomes and everything. So it's a full counseling, and the visit takes a while to do all that, to be comprehensive with that. So now we're actually double booking and trying to catch up because people are really doing that. So the genetic counseling dropped off, and that has really picked up. We had breast cancers who, the national recommendations were not to operate on breast cancer. To me, it just blew my mind that, through the COVID-19, we were delaying cancer surgery. But that was the national recommendations by the National Clinical Cancer Network, the American Society of Breast Surgeons, the American Society of Anesthesiologists. They all got together and came up with the recommendations and a staging as to who absolutely should go. But if somebody has a newly diagnosed breast cancer that's estrogen receptor positive, the answer was to put them on hormonal therapy first, which normally we never do that. We do that after surgery. And so we had a backlog of those patients that as soon as the restrictions were lifted, they were the first priority that got done. But we no longer have those restrictions. We're fully open with mammogram, breast MRI, genetic counseling. The whole works with the breast center is up and going.
Colonoscopies, breast care, any medical concern, Indiana Regional Medical Center is ready for you. And that point needs to be made because folks cannot put off health care without putting themselves at risk of, okay, I'm protecting myself from this thing, but I'm opening myself up to this thing, and that could even be worse.
Right.
It doesn't need to happen.
It doesn't. I can't stress enough that the hospital and IRMC is one of the safest places to possibly be. I feel safer in my office and operating than I feel anywhere else in the community because of all the precautions we have put in place. We've overdone it, and that's what we should do. But we've done that for the protection, not only for our patients, but also for our staff as well. We don't want to get it. We don't want our staff to get it. So we've done it when we don't want our patients to get it. So we've gone overboard in what we need to do to protect people for this. The recent restrictions that happened just this week, we've seen a little bump. And, so we've had to unfortunately go back to restricting visitors in the hospital again, because we've seen the asymptomatic carriers increase. And so we don't want people bringing that into the hospital. Now, hopefully that will be temporary. That kind of coordinated with the reopening of everything, and it coordinated with the July 4th activities where people did get together without physical distancing and, without proper protection. Masks do make a difference when you're out in public. And it's shown up because we have seen this spike, and it's not because we're testing more. We were always doing pre-op testing. We haven't changed who we test. We only test symptomatic patients or patients who are going preoperatively for the operating room. We're not doing massive testing. There's not the supplies to do massive testing. The backlog in the country with testing is phenomenal. We were using Quest, and they were giving us a 72-hour turnaround. Now they can't even promise us any turnaround because of how backlogged they are, because of all those other states, California, Florida, even Delaware, Myrtle Beach, all those places that are being inundated with cases have backed up the testing dramatically. So the other exciting news is finally we got our own equipment at IRMC. So we ordered this. I'm not in charge of this. Dr. Wilson, who's in charge of the lab, has been just working overtime. I can't give him enough credit as to how far he's gone above and beyond with the COVID test and everything. But we ordered the equipment so that we could do it in-house, actually true in our hospital laboratory, back when this first started. But unfortunately, so did every other community hospital in the country. So the equipment wasn't available and backlogged. So we just got our equipment this week. And we're very fortunate that, it's going through the validation process. There's a lot of things that we make sure that it's accurate and everything like that Dr. Wilson is doing. And that should be up and running this weekend. And so as of next week, we should have the capability of not having to send tests out and being able to do all of our COVID testing in-house at IRMC beginning next week.
We use that phrase game changer a lot. That's a game changer.
Right.
It absolutely is. All right, so wave to our people on Facebook. Mask up for them so they can recognize who you are. He's got his mask with him.
I got my mask with me. Where did I put it? Nope.
Not there, not in that pocket.
It's in the other pocket.
That's that $1 you left in the other, in your pants the other day. So
that's my wipe, so when my glasses fog up, I can wipe them off.
There you go. There you go. There he is. It's a Steeler pink ribbon.
That's right.
A face mask. Dr. Dan Clark, thank you for coming in to visit with us today.
Oh, you're welcome. One other quick thing.
Sure.
Our national certification for breast was supposed to happen. That was put off with COVID, but we have applied, we've been accepted. So by the end of the year, IRMC is going to be a nationally certified breast center.
Beautiful. Beautiful. Dr. Clark, we'll talk with you again, and I hope frequently.
Sounds good.
It is the voice of Indiana County, WCCS 101.1 FM, AM 1160.